India is in the middle of a war against one of humanity's oldest and deadliest enemies, tuberculosis. And the goal it set for itself is, well, hugely ambitious, to completely eliminate the disease by 2025. So let's dive into the data and see what's really going on in this monumental public health battle.
First, I just want you to look at this number, 27%.
That's right. Over a quarter of all the TB cases in the entire world are in India. Behind that single percentage are millions and millions of people. And that is exactly why the country set that incredibly bold goal to wipe out TB by 2025, a full 5 years ahead of the global target. So how's the fight actually going? Well, you might think the story is all bad news, but the first part is actually a story of remarkable progress. I mean, despite the sheer scale of the challenge, India's National Tuberculosis Elimination Program, the NTEP, has made some really significant, measurable strides. Just take a look at this chart. It shows a huge win in an area that used to be a massive blind spot. For years, countless cases diagnosed in the private health sector just went unreported. They were invisible. But look at that jump. From less than 200,000 notifications back in 2015 to over 840,000 in 2023. That is a gigantic improvement in just tracking the disease. And all that tracking and treatment, well, it's leading to some very real results. Check out this figure, a drop of nearly 18%. Now, this is absolutely crucial. This isn't just about finding more cases that are already out there. This means fewer people are getting sick in the first place. The rate of new infections, the incidence, has actually fallen. It shows the national effort is genuinely slowing the spread. And if you think that's good, here's what might be the most important metric of all, a 24% reduction. What does that mean? It means people are surviving. These efforts are literally saving lives. Deaths from TB have dropped by almost a quarter since 2015. Better detection, better treatment, it's making a life-or-death difference for hundreds of thousands of people. Okay, so this brings us to the central paradox of this whole story. We've just seen all this positive data, right? More cases found, fewer new infections, fewer deaths. So why does practically every expert out there agree that the 2025 elimination goal is, well, impossible? The answer is that all of this progress has actually helped uncover the true, massive scale of the challenges that are still left. The story of India's TB fight today is really defined by three major headwinds. These are the deep, systemic problems that are pushing back hard and standing in the way of a final victory. Okay, problem number one, we're not just fighting one disease anymore. On one hand, you have the standard drug-susceptible TB. It's tough, but it's treatable with a pretty high success rate. But on the other hand, we now face a much, much deadlier version, drug-resistant TB. The treatments are long, they're toxic, and they've historically been way less successful. And here's the scariest part. It spreads from person to person just as easily as the regular kind. And the scale of this crisis is just immense. India has more cases of drug-resistant TB than any other country in the world. Now, there is some good news. Newer, safer, all-oral treatments, things like Bepalem, are a total game changer. But, and this is a huge but, having a solution on the shelf and actually delivering it to millions of people who need it, those are two very, very different battles. The rollout of these life-saving drugs is still pretty slow and patchy across the country. The second big problem brings us right back to the private sector. Remember that huge improvement in reporting we saw earlier? Well, this slide shows why it's still not nearly enough. Even now, the private sector only reports about 1/3 of all TB cases. But get this, studies show that up to 70% of patients actually go to a private doctor first. That gap, that difference, represents a massive number of missing cases that are just out there fueling the epidemic. And that leads us directly to the third burning problem. This one isn't just about the disease itself. It's about the devastating impact it has on people's lives. We have to talk about the crushing human cost of TB. 68%. Just take a second and let that number sink in. That's the percentage of households with a drug-resistant TB patient that face what experts call catastrophic costs. That means the illness forces them to spend more than a fifth, 20% of their entire yearly income just on diagnosis, travel, and other costs. It pushes families deep, deep into poverty. In this slide, wow, it just powerfully shows you the gap between support and reality. The government provides 500 rupees a month for nutrition, which is vital.
But one study found that the median out-of-pocket spending for a patient was 32,000 rupees. The financial support, while so well-intentioned, is just no match for the economic devastation this disease causes.
As one research article put it so perfectly, TB creates a vicious cycle of disease and destitution. You see, poverty and malnutrition make you more vulnerable to getting TB in the first place, and then getting TB pushes you and your entire family deeper into poverty. It's a social disease every bit as much as it's a medical one. So, with these enormous challenges, where does the fight go from here? Well, the good news is this isn't a story without a plan. Experts have a clear, data-driven roadmap. The 2025 goal might be out of reach, but the war is far from over. Let's look at the new strategy that's being built to win it. The path forward really rests on 4 key pillars, and each one is designed to fight back against those headwinds we just talked about. First, to beat drug-resistant TB, you have to aggressively scale up those new, shorter, safer treatments across the entire country. Second, to close that private sector gap, you have to fully integrate those providers with incentives and tech. Third, to ease the crushing human cost, social and financial support has to be much, much stronger. And fourth, to find all those missing cases, we have to leverage new technology like AI-powered X-rays in the most vulnerable communities. That original 2025 deadline, it served a purpose. It created incredible urgency and momentum. Now, the challenge is to channel all of that energy into a new, smarter, and more sustainable long-term strategy. The big question isn't just about hitting a date on the calendar anymore. It's about whether India can build on all its progress to finally win the long war against this ancient plague.